I'm Rick Buck and I've been a dentist for 15 years. Let's start at the most straightforward pathway of pain in your gums. In this video, we will go over most of the possibilities as to why teeth and gums ache and throb on their own. Let's start at the most straightforward pathway of pain in your gums, and that is a gum infection, referred to most often as gum disease, gingivitis, or periodontitis. Here is what happens. The longer plaque and tartar that house the bacteria adhere to your teeth and sit on your gums, the more destruction the bacteria does to the ligaments and the bone and the gums that hold your teeth into place. This is gum disease. If you have gum disease, you will likely notice a lot of buildup on your teeth if you pay close attention. But for some people, the plaque is hiding deep below the gums, so you may not notice the plaque. Most of the time, people with gum disease have gums that will bleed easily when flossing and brushing, and that is the #1 sign of gum disease. Now, if you have gums bleed once in a while, that's fine, but if they bleed quite a bit or almost all the time when you're flossing and brushing, that's the sign. Now, for some people, gum disease may never cause pain, but for others, the pain can be quite intense. To help recognize the pain, normally the pain can be fairly constant but can be exacerbated by chewing. The main causes of gum disease are mostly sugars and our modern diet mixed with insufficient oral hygiene care. To help illustrate how sugars cause gum disease, there was a study of people who were put on an ancient diet without refined sugars. And what they noticed was all their gum disease indicators started improving even though they still had poor oral hygiene, which means their gums started bleeding less and things like that. So to prevent this in the future, giving up sugars is the best way to deal with the problem. But anyway, the treatment for gum disease, since you already have it in this case, if it hasn't progressed too far, is a deep cleaning. Any increased home care without a deep cleaning, once you have gum disease, just won't be sufficient to get rid of the gum disease until that deep cleaning is performed. But obviously still do good home care until you have the deep cleaning. Antibiotics can be a temporary fix for intense cases, but the source of the infection is that tartar, or what we call calculus, stuck to your teeth like barnacles that house all that bacteria, and those are the source of the infection. If you want the best generalized home care routine, watch my daily care routine video. Everyone should watch that video that will pop up at the end of this video. I actually show you in that video, and you can see how to get stunning results when brushing and flossing. But going back, once again, the only real remedy for gum disease is a deep cleaning. Everything else will do minimal until that has been done. And consider yourself lucky if you do develop pain to gum disease, because at least you are warned of your condition. You see, those who don't get pain with their gum disease are normally the people that end up with dentures because they let their gum disease go until it's just too late. And I would say that's the most common reason that people lose all their teeth. Let's move on to another possible gum pain, or mechanism as I like to call them, which is actually tooth ligament pain or tooth ligament inflammation, because the tooth ligaments are part of your gums and it definitely feels like your gums when you get tooth ligament pain. You see, your teeth are anchored to your jawbones by tiny little ligaments. Those ligaments can become stretched, sore, and inflamed. For some people, the pain associated with it can be quite intense, or for others it can be quite subtle. In other words, the pain can vary a lot on the pain scale. Besides the intensity of the pain, how you feel the pain can be different. For some, the pain can be an aching seemingly on its own, but then for others, the pain can be triggered by biting on the teeth. So let's go over what causes or triggers the tooth ligaments to become sore. The first is clenching and grinding. Most people clench and grind their teeth at night when they sleep, but it can happen during the day as well. Some people do it more than others, and you will do it at certain points in your life more than other points in your life. Most people don't even know they are doing it. In fact, clenching sometimes can temporarily make clenching pain feel better, thus creating a vicious cycle of more pain when the inflammation sets in even further. Most times people with clenching pain find it difficult to locate the pain because the excessive pressure is distributed among many teeth, though sometimes it can be just 1 or 2 teeth. Also, the pain can normally happen on a routine with nighttime or morning soreness, depending on how your body and the ligaments respond to the pain and the clenching. A lot of what I hear is people will say this pain comes and goes a day or a week at a time, and then it'll go away and then come back another day or week and so on. If you have inflamed ligaments due to clenching and grinding, I have a full video on this. Aside from clenching, Food impaction or getting food caught in the teeth can cause inflamed ligaments and gum pain. The pain associated with getting food caught in your teeth is a little more intense and localized, meaning it is easier to pinpoint and differentiate. In fact, the pain is likely most intense when eating. Popcorn husks are a big culprit for gum irritation due to getting things caught in your teeth. Food impaction is very common for people who have adjacent teeth that don't contact each other tightly or butt up against each other tightly. So if you're a person and your floss doesn't snap through and it just glides through, people like that will commonly get food or gum pain due to stuff getting caught in their teeth too much. The best remedy to this is to remove the debris with floss. Anyway, what you do with the floss to remove debris, if you have lots of debris or if there's something you just can't get out, is tie knots in the floss and then snap it through and then thread it back and forth until you dislodge the food and it comes out from between the teeth. I have a video about that too. Ultimately, if you have a large gap in the teeth causing a lot of food impaction, a dentist can do a filling or a crown to tighten the space and minimize the food impaction. Let's move on to gum irritation. Besides infection, there are a few things that can just irritate the gums. A simple example I see quite often are burns on the gums from eating things like hot pizza or other hot foods. Another one I see is irritated gums from biting hard crusted bread or any food against the gums that is hard, sometimes even chips. An area where this gum irritation from chewing hot foods or hard crusted food will happen just behind the front upper teeth. Another cause of gum irritation is aggressive oral hygiene habits. Some of the causes of this pain are brushing too hard, flossing too hard, using a hard bristled toothbrush, or excessively using a toothpick or other habits like that. Things poking into your gums can be another irritant. For example, I've seen random bone spicules that can suddenly emerge and poke into your gums, or sometimes an overhanging filling that a dentist has recently done can poke into your gums. These things can be so small but cause intense pain, and those things won't go away until normally a dentist removes the irritant causing the pain. Speaking of dental work, from time to time, gums can become allergic to metals in some of your dental work, especially older crowns. You see, some older crowns have metal as their base, and that metal will have nickel in it that causes an allergic reaction. Normally it's pretty small, the reaction that it has, but it does happen. This allergy to metals and the metal in your crowns is more common in women because simply women more commonly have metal allergies. Basically, if an irritant is causing gum pain, it won't go away until the irritation is removed or reduced. Moving on, gum pains can also be caused by lesions. What do I mean by this? This is difficult to cover because there are a lot of types of lesions that cause different things to happen. The more common lesions are things like canker sores and viral ulcers like herpes and shingles, which will cause a lot of pain and will be quite obvious. But for some people, it isn't that obvious. They'll have these lesions and they won't notice. They'll only notice it as gum pain. But there are other lesions besides this. There are other things like gums that kind of slough off from autoimmune diseases or tobacco chewing lesions, or many other possibilities. If you have an odd lesion, go see your dentist or doctor right away, especially if it lasts longer than 7 days. Now, moving on, fungal infections are also a cause of gum pain. Fungal infections are caused by microscopic or invisible fungi proliferating in the mouth, causing a burning sensation. The most common cause of a fungal infection is a dry mouth or lack of saliva. Saliva has important antibodies and features that prohibit fungal infections. So dry mouth is kind of the big cause of fungal infections. Dry mouth this day and age is most commonly caused, from what I have seen, by medications. And it gets worse as we age too, but especially because of those medications. Now, if you're thinking you want to drink a lot of water to battle the dry mouth, you should know drinking water will not compensate for the lack of saliva, as it does not contain antibodies. Only eliminating what causes dry mouth can completely cure dry mouth, which normally takes a conversation with your doctor about prescribing alternate medication or other ways of eliminating the medication, or even reducing the dosage if possible. If you're unable to reverse dry mouth, your best bet is to stimulate your saliva by xylitol gum or biotin rinse after eating each meal. If you do have burning gums, you need to get in to see your dentist. A dentist, most times in this case, will prescribe an antifungal if you have burning in your gums. Another common thing I see, like once a month I probably see this, is someone that comes in with gum pain only to find out that their gums hurt because they actually have an abscess from a tooth infection. What happens here is that the infection makes its way up into the tooth, and the tooth then becomes the source of the infection for the bacteria to go out and then destroy the surrounding gum tissues. So once the infection is in the tooth and it starts spreading outward, it will affect the gums, the bone, the ligaments that hold the tooth in place, like I mentioned before, and it just kind of starts destroying everything, and you feel this as a pain in your gums. So when the bacteria start to destroy the bone and surrounding tissues, this creates a pocket or abscess in the jawbone. This abscess is normally easily seen on an x-ray, and it can cause aching or pain to chewing as well. A couple notes about abscess pain. Once you have an abscess, there's nothing you can really do to treat it on your own. A dentist will need to treat it. Another reason why it's important that a dentist looks at it is sometimes it's actually a referred pain where you will feel it in one spot, but the location is actually from another tooth. Anyway, to help you differentiate if this is a pain related to you, if the pain intensifies while lying down, you can almost be certain it's a tooth infection or abscess of some sort. If you have a tooth abscess that has not progressed too far, then a root canal is the only way you can save the tooth. Antibiotics are only a temporary fix, as the central canal of the tooth that has lost the blood supply to fight the infection is the source of the infection, and so the antibiotics can't get up into there. So that canal must either be sealed off with a root canal treatment, or you can remove the tooth as well. And you may need to have that tooth removed anyways if the infection has progressed too far. Everyone should watch my daily tooth care routine video I have posted now, and I will show you in that video why it is the best technique and products to brush, floss, and more. Now, this video is part of a larger series of oral pain I am doing, so you can match the symptoms we talk about here and watch more videos on a possible diagnosis and treatment. That way, you can further narrow down and find the cause of your pain and hopefully find a remedy and see a dentist that can provide you an official diagnosis and treatment. If you're in Southern California, my dental office is linked to below. Like and subscribe if you have teeth.